with the typical losing of the weight. And Comandante Fidel Castro went into the Institute of Health in Cuba in 1983, commanded Dr. Pedro Curi to find out what was this thing coming from the United States called AIDS. And the doctors in Cuba were all saying that they didn't know whether it was a viral virus or a fungus. The first thing they did do in 1983, all of the units of blood for transfusion were thrown out of Cuba. Cuba has never had a case of HIV or AIDS due to transfusion. I just wanted to start with that. And then the first official case was in 1986. What I mean by official cases, from 1984 to 86, because of whatever political reasons, the embargo from the American government to the Cuban people, no tests were sold to Cuba from the United States or its allies. Finally, in January of 1986, France broke through the embargo and sold the Cuban people, forget politics, the Cuban people that had a high need, 750,000 units of tests. From there, the Cuban scientists emulated the test. And that's when the following step took over, which was mandatory quarantine, which a lot of people were against, because even though it was erroneous and admitted by the Cuban government, they thought that the expectancy was always going to be 1 year and people were going to die, which was the case because there was no treatment, no medicine, nothing. So sanatoriums were erected all over the island. I am proud to say that since 1993, that is not the case no more in my country. The quarantine is voluntary. It is for 8 weeks. And during those 8 weeks, not only are you trained by doctors, health workers, and nurses, but you also are shown how to live a healthy, enjoyable life with HIV. Thank you.
Thank you. Are you dealing with just the first case here, or the case and the statistics question?
Just give a brief outline of the situation of HIV today.
Today, okay.
And when
okay,
did
okay.
situations become a problem?
Okay. In Jamaica, our first case was definitively diagnosed in 1982, but we recognized that stuff was going on before that we didn't know was likely HIV/AIDS. And our group is the same as in Chicago. It is HIV-2. It's the viral type 2 is our big bogey. Other than that, I'll just give you the statistics when that comes up.
Hi. In the U.S., the first cases were 32 years ago. That was 1982. 1980 was the first cases in the U.S. And primarily the cases that they saw were men who had had sex with men. They were primarily white, gay men who had had sex with men. And then they started to slowly see in the heterosexual community, heterosexuals who were IV drug users, and then, of course, they started to then trickle down to see heterosexuals who were either transmitted through blood, through a blood transfusion, or through some type of blood products. What's interesting about, this is just a little tidbit that I think is interesting. The French actually were the first to discover the HIV antibody test. But what happened was the American scientists stole the test and they rushed to patent it. Now, what was interesting, though, the French were so outraged that they refused to use the American patent, and they, unfortunately, there was a whole host of people in France that were infected with HIV because the French refused to use the American test, therefore they couldn't test all donated blood in their own country. Like hundreds of thousands of people were infected. So I just, piggying back off of that, I just wanted to give you that tidbit. And so that's really, then we started to see other people of color with HIV, but they were primarily gay white men originally.
Briefly, I am from Puerto Rico, so I'm going to briefly explain the situation in Puerto Rico. It was in the early 1980s, the first situation that we see that people were infected with what they didn't know what was happening with them. And of course, because of the situation here in the United States, that priority was given to the gay whites in this country when they were the ones who were giving the information. And during that time, the Latino and black population were being infected left and right throughout all the United States, particularly in the major cities. Puerto Rico, being a colony of the United States, was definitely infected in that, and we were recognized in the early 1980s. The organization that I work for, Vida Sida, established its doors in 1988 due to the fact that we were seeing people dying in funerals, most time in Latinos and like in black, it's a very big event for people cry and join, and they have an open casket. And we were seeing closed caskets, funerals with closed caskets, which is very, very rare in the Latino community. This is when we know that we had a very, very major problem because people were ashamed because it was all stereotyped that it was gay people that were being infected, and we also had the whole stereotype of homophobia. And that definitely led to the whole spread of HIV in the communities of color. And so therefore, in 1980, in the early 1980s, when we see this situation arise, and it's not till close to the 90s that we become aware of it, and then we try to do something about it, okay? Since noting the fact that, this was orientated that this was a gay infection, and they were orientating themselves to take care of the gay population, we now know that that's not a fact. And I'd like to see if each panel that we can actually demonstrate that HIV is not a gay situation, that we all know right now. And today, who are the people who are being infected in each of the countries that are represented here? Do you want to start from the other side?
Okay, in the U.S., there are about 30,000 new cases a year in the U.S. of HIV. To be really honest, men who have sex with men are still the largest number of reported cases in the United States of America. It really is. But what we have seen is there is an increase of other women. We've seen an increase in women. We've seen an increase in senior America, like 38% increase in the 65 and older community. With the rise in sale of Viagra and Cialis, we've seen an increase in sexual activity among senior community. We see a young community that's not gay and bisexual. We see more heterosexuals. And so while men who have sex with men is still the number one way HIV is contracted in the U.S., the other methods have still risen at disproportionate numbers. And in fact, while we see men who have sex with men as the largest number, 52% of all cases of HIV in the U.S. are African American, and we comprise somewhere 13% of the population. And so that is both heterosexual and men who have sex with men, IV drug users, with HIV in the U.S. The majority of them are African American. And so we still have a huge problem in our community when it comes to HIV. The issue is that many of the resources that are allocated in this country are still disproportionately allocated to the organizations of men who have sex with men, and everybody else is left to scramble and fight for what's left over. And so we're not really able to tackle this issue in our community, and then of course stigma and shame and our inability to take ownership to HIV within the black community.
For us, our rate is 1.7% of the population, and that's about 32,000 of us with HIV/AIDS. It is the same as last year because rates are dropping due to more careful MSM practices and more careful sex worker practices, we call it. We don't deal with the word prostitute anymore. The 50% of those who have been surveyed, and mark you, the people that we do survey are automatically going to be over represented, the people who come to us are overrepresented in these surveys because they are the ones that are interfacing with us. 50% of them don't know their status, and we're going to expect to see about an estimated 2,500 new cases in 2012. It's something that they're saying we still, like Ray is saying, we're going to have to target the MSMs, but the fact is that although it says that only 7% of female partners of MSMs will be the rate this year, none of us actually, empirically what we're seeing in the clinics, the highest group of new infections is among, and the rate of fastest increase is the heterosexual women. Because we have them, a lot of our men are bi, and their practices are very bi. So, you know, and the condom use, well, I mean, let's see what we have here. 42 say they use condoms all the time, and 10% say they never. And so, you know, there is this other thing that we average, check this out now, in the last year, men from in the young 20s and 30s, average in the last year alone 7 partners to one man, to 7 female partners to one man, and 32% or 23% of these are in a stable relationship where they have a primary woman, but they're still, yeah, we share our men. So, what can I tell you?
Actually, in my country, in Cuba, at the beginning, the cases, because of the Cuban foreign policy sending